I'd like to introduce Norma. Norma is a lovely 60-year-old lady who desires to have a rejuvenated facial look without undergoing surgery. My goal today is to use the most effective treatments to give her the best results with the least risk of problems. We've decided to focus up close on Norma's face. Before we can institute treatment, we have to have a great analysis and plan. And the area that's most effective is up in the upper facial region, starting first with the glabella. So Norma, would you please give me a nice big aggressive frown? Now, most people don't like these muscles that crease up the forehead and create these 11 lines. So if we look at the glabellar muscle, we can usually plan 5 injection points across the thickest part of the glabella muscles, which includes the corrugators, mainly the corrugators, and sometimes the processus. These muscles, when they contract, they cause the accentuation of the 11 lines. This obviously will not be enough to correct her, because Norma, would you please just relax for me a little bit and just look straight ahead. When she's fully relaxed and the muscles are not engaged, the 11 lines are still active. So this is going to need some static fillers. We're going to use Regardez-le for that. The second thing Norma complained to me about was her forehead lines. She doesn't like the forehead lines. She's very concerned that her brows will change position. And you can already see before we've done anything, you can see the right brow is a little bit lower than the left brow. I'm going to have Norma elevate her brows high. And you can see that she has a modest amount of lines. It's not extensive. So I'm going to try to place injection points. They'll give me about a square centimeter around it of treatment zone. That's effective. Third area I find it very effective, botulinum toxin or neurotoxins, is along the crow's feet. I'm going to have Norma give me a nice big smile. Now, when she's smiling, you can see the activation of the orbicularis muscles that's contracting and creating the crow's feet. I like to creep up on this area, get just a little underneath the tail brow, and put some botulinum toxins around this area. Big smile. The dosage I always use is proportionate to the size of the muscle. In my past experience, I found 25 units of botulinum toxin is very effective to control that. Across the forehead, I'll be using 12.5 units, using 2.5 units at each one of these sites. I'll be using 10 units at each of the crow's feet area. The fillers I find to be very effective in camouflaging and changing contour of the face. I love fine fillers such as Vital or Regardez-le across these finer lines. Norma mentioned to me she really didn't like these deep nasolabial folds. I think they are deepish, but they're not horrible. My personal recommendation for Norma before we start treating that is let's go ahead and try to augment the cheek area. If we augment the cheek area to increase the linearity from the corner of the eye down to the angle of the mouth, I find that if we smooth that transition out, it'll give her a nice facial angularity that will camouflage the aging triangular fat that has dropped in this position. No filler can actually create tension and change the orientation of the face. In my opinion, fillers offer a camouflaging procedure. If we're able to simply place some fillers to augment the cheek area here, with a goal of making sure we have this line oriented, filling up the cheek area, particularly in this area, using a cannula and a thick filler such as Perlane, I find that to be very effective. We've just finished designing our injection points for both the neurotoxin and the fillers with Norma. I've always set up my set so everything's ready to roll and we can follow smoothly. We have our neurotoxin here, we have our Regardez-le, and we have our Perlane. We'll not be using the hypodermic needles as part of the kit. Instead, I will be using a 25 gauge cannula. 25 gauge cannula I simply just mount like I would a hypodermic needle. It's a long cannula. I tend to use just one injection point. What makes the cannula very specific and useful is that the tip is blunt. If I push it against my skin, it won't pierce my skin. The hole's on the side. I tend to use this to bluntly engage the tissues and place the gel where I want exactly. Causes less bruising, and I can usually do it with one injection portal. In order to access the tip of the cannula into her tissues, I need to use a hypodermic needle to pierce a hole, and we'll be following through on that shortly. To reduce the pain, I have actually resuspended the botulinum toxin with a preservative saline. It tends to reduce discomfort. I also tend to pinch the site. When I pinch the site, the amount of discomfort tolerated by the patient is reduced. I inject slowly so that the discomfort level is missed. There's just 5 little injections. Each of these injections will require 5 units. I'm going to go to the other side, pinch it. Once again, continue. We only have one more injection point after this one, Norman. You're tolerating very well. And there we have it. We have all 5 sites injected. The swelling that you see can frighten people, but it is a water-based solution, and that swelling allows me to see where the entire front corrugator muscles are injected, and it will disappear in about 20 minutes. We're now going to proceed with the forehead lines next. Excellent. Once again, these little bumps allow me to estimate where the action of the medication will be, and you can just anticipate there will be about a square centimeter around the injection point that will be affected. And already you can see there's some diminishment in the little bit of fluid that's been injected. I'm going to turn my attention now to the crow's feet, and we're going to put around 2 to 2.5 units right there. Nice shallow low blebs, keeping it shallow into the orbicularis muscle. Once again, we should see a tiny ring of swelling of where I expect the botulinum toxin to act. These little areas of swelling will disappear fairly quickly. And once again, Norma has been an excellent patient, tolerating these discomforts quite well. Just want to get close to the orbicularis muscle, put about 2.5 units of botulinum toxin right there. And just walk down a little lower along that orbicularis. Put about 2.5 units. And she's tolerating that very well. So I'm just going to wipe off that area, and we're done with the botulinum toxin. I'm going to turn my attention to her 11 lines. We can see the fold that's being formed as if she were moving there. I find that the line on Norma's right side of her body, right here, is the deeper of the 2 lines. I pass my needle forward and traverse the whole length of the line, and I just run a line of filler smoothly back here. I find by injecting on the drawback, it tends to be a little bit smoother. So there's one. So I'm just going to check the area that I've already done. So you can see already it's resisting my pleating a lot more than before. Now it's still pleating down low, so I'm going to go back down low. We've already used about 0.4 of the syringe, and already I can see a very substantial improvement in that line when I pleat the area compared to the other side. So I'm going to do the upper part of the line separate so my hand doesn't cross over the camera. Upper part of the line, I go full length, staying shallow underneath the deepest part of the line, and inject on the drawback because it's the smoothest. Then there's 2 passes. I'm going to go a 3rd pass. So far it looks really lovely. I'm pleased with the response. There is some swelling in this area. So I'm going to just take my fingers and just try to roll that gel to spread it a little bit within the tissues. At this point, we have now finished treatment of the glabella, the neurotoxins. I'm going to focus on her right cheek. My intention now is to orient myself so I can get 1 cannula, 1 injection point to restore this line, aiming to fill up mainly this cheek. So I'm going to try to use 1 entry point into the pocket underneath the cheek fat pad. We may need up to 2 mLs of filler per cheek. I'm going to start off and just see how she fills up in this area. I now need to make a hole and a break in the skin, otherwise the cannula will not go through the skin. So I'm going to just pinch it up, heel right here. I'm going to enter the skin just to break the skin. So I'm broken the skin. I'd like to see a tiny little drop of blood or a dimple so I can enter the cannula. Here I can see that tiny little drop of blood, and I'm going to stretch the skin and enter a 25 gauge cannula. It's in her skin. The first passage point is through the subcutaneous tissue. So I pinch up the skin once again, to lift up her cheek, making sure I don't pull on her eyelid too much. And I want to make a little straight line through the subcutaneous tissue. So if there's a little pop, I've just started to enter through the subcutaneous tissue. But the first thing I want to do is start putting some gel along this area. This should be a relatively painless procedure. And this should be my only entry point. I'd like to give a summary of our treatment for Norma today. The botulinum toxins should start working in 3 to 5 days and will stabilize in about 10 days and be effective between 3 and 6 months. We then followed that treatment with the fillers. Here you can see Restylane. Restylane was injected very superficial, causes swelling in the area briefly. You can also see the cheek fillers that have been placed with a cannula on each side. Thank you very much for joining us today. I hope you join us again soon for our next treatment.